Hello, ladies and gentlemen. Thank you for joining us. The Oral Boards is a special event in all of our careers. We therefore thought it would be reasonable to dedicate a session to the topic. We're happy to have with us today Dr. Bill Couldwell, who is the head of the Oral Board Subcommittee of the American Board of Neurological Surgery. Bill, thank you for joining us.
Welcome, Aaron. It's a pleasure to be here and talk about the format and the scoring of the oral exam. So this is the current format and scoring of the exam. We've been making changes over the past few years, but all of the candidates that we'll be examining will have completed a neurosurgical residency program approved by the RRC of the ACGME. They would have passed for credit the written primary examination during their residency, and they must submit an application within 5 years of completing the residency. They will have submitted 150 cases of operative data reviewed and approved by a board member, and also submitted letters of recommendation, evidence of licensure, and current hospital appointments. So the format of the exam is that there's 3 one-hour sessions, and in each of these sessions there'll be 2 examiners. One examiner will be an ABNS director, a current director, or a former director, and the other one will be a guest examiner. And they'll be asking alternating clinical vignettes to the candidate. The topics covered will be as listed: spine and spinal cord, perhaps peripheral nerve in that section as well, cranial, extracranial vascular, critical care, neurology, pediatric neurosurgery, functional surgery, and pain surgery, and peripheral nerve surgery. So the examiners have been specifically instructed to avoid humorous or aggressive comments. They will not attempt to correct or teach. They'll provide no feedback or verbal clues as to whether the answer that they've been given is correct. We won't dwell on weaknesses or strengths, and we'll move on to other topics. And we won't ask trick questions or ask for any didactic material. Actual clinical encounters are simulated during the exam, not like a written exam, and there'll be patients presenting in the ER for an office visit, being seen in the ICU, and OR simulations, etc. Candidates will actively participate in the process, so it'll be an interactive process, and you'll ask for the data needed to solve the problems presented. And the candidates are expected to provide rationale for their decisions. So we may ask you, why did you do it this way? And as long as you have a reasonable rationale, that is acceptable. So the typical format is that there'll be an oral presentation of the patient's history and the physical examination findings. The pertinent test results and images will be presented. The candidate will be asked to propose a differential diagnosis in order of priority. They'll be asked to initially manage the patient, including the medical management, surgical planning, if so indicated, and specifics about the surgical procedure, including incision location, flaps, operative technique, and intraoperative complications may be given, and then they'll be asked to also comment on postoperative management in the appropriate scenario. So we ask a minimum of 6 questions per hour in each of the hours. So we'll move on to the next question if the candidate is stumped. And an oral exam is not centered on interpreting images, but you need to understand that you need to be able to interpret the appropriate images to make surgical decision-making in the absence of a radiology interpretation. So extensive radiological interpretation of the examination will not be tested, but we'll expect you to make straightforward management decisions. We want you to focus on judgment and be open to alternative solutions. So there's many different ways of handling problems. We understand that, and the examiners are instructed to be open-minded to this. The exam is comprehensive, and so the candidate should be able to answer all questions regarding the entire spectrum of neurosurgical diseases, despite their subspecialization. And the sort of metric that we use is whether this candidate